I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Today's episode of IDD Health Matters, I have with me Chris Helfrich. And she is a nurse in the field. She's an integral part of the Developmental Disabilities Nurses Association. We are here at the Developmental Disabilities Nurses Association annual conference in New Orleans. And Chris, I welcome you to the podcast today.
Thank you very much.
And let's start off with just telling us about who you are and how you got into this field.
Sure. Okay. Well, I am a nurse. I was working about 10 years in a hospital setting and working third shift, and a friend called me during my sleep time, which is typical people's daytime hours, and asked if I was interested in a daytime position, nursing position. And I thought, sure, why not? Woke me up at 2:00 in the afternoon, interviewed 25 minutes later, and was given the job. That should have been a flag. That should have been a flag. Had no idea, completely took a leap of faith. And I was simply looking at the ability to transition my life to something that felt more normal. So had no idea, again, what I was getting into, and was given a set of keys, a pat on the back, a binder that had some training information, and then asked if I could go see an individual who was complaining of knee pain. And I thought to myself, sure, let's do this. That's how I got into the field.
Well, that's being thrown into the fire for sure.
Correct.
Yeah, I get that feeling. And so the extent of your training in this field was 2 minutes with the binder, probably. Here, learn this.
I don't know that I ever had time to look at the binder. I probably still have it, but it was really just boots on the ground and just a lot of autonomy, a lot of trying to MacGyver my way through things, and of course trial by error. Some of those learning experiences happened, and then I found DDNA and realized that was my lifeline.
Well, I can relate to that. And that unfortunately is all too common of a story because we, nurses, physicians, dentists really don't necessarily receive training specifically related to providing healthcare to people with intellectual and developmental disabilities, which is a big issue and something that we have work that we can do on for sure.
I hope so.
So that was your start.
Okay.
So tell us, bring us to where we are, okay. and what are you doing now?
Fast forward. All right. So I am 23 years with the same agency. We are a non-for-profit agency, and we are supporting individuals with developmental disabilities in the state of Illinois in 144 group homes across the state.
It's a pretty big operation.
It's a very big operation. I'm super happy to be a part of this. It is a growing operation. We, in 2013, closed a very large facility that we had an ICF, and opened 25 new SILA group homes to bring these people into a more normalized community-based setting.
So tell us what a SILA is.
A SILA is a community integrated living arrangement. It's an opportunity for individuals with developmental disabilities to live in normal homes and in a typical environment in their community.
So that's one of the things that I also find interesting in this field and kind of working on a national level now. You learn the structure of one state, and you've learned the structure of one state because there are many, so there's different names, there's different acronyms, but basically it's all about doing the same thing.
Correct.
Which is providing opportunities for people with intellectual and developmental disabilities to live community integrated full lives.
Correct.
Yeah. So it's a pretty field to be in, isn't it?
Yeah.
Yeah. There's a few challenges in the field too.
Absolutely.
I'm certain. What would you say are some of the challenges?
I think one of the challenges that we continue to come back to is the educational deficit, and that's anywhere from our direct care staff to the nurses and to the physicians providing care for these individuals. I think that there's multi-levels of education needs that would help benefit those individuals. I definitely think, again, with my nurse mind, I do think that there's some health disparities out there. Lots of studies that are looking at this, and hopefully over time we'll start to see this kind of plateau so that our persons those with non-typical challenges are going to be supported just as those patients of physicians that that don't have atypical challenges.
And there are a number of health disparities.
Yes.
We know that there are a lower number of preventative screenings that are being done for things like prostate cancer screening and cervical cancer screening and breast cancer screening and colon cancer screening and dental preventive care. Dental care is a big issue.
Sure.
There are disparities in terms of outcomes from different conditions, and not to get into too many specifics here, but sometimes there are unexpected or poorer than expected outcomes in terms of people who are hospitalized. We saw with the recent pandemic, there were people with disabilities had a much higher chance of dying.
Correct.
Than those, and that's multifactorial, probably a little more than we'll talk about here.
Okay.
But I think the educational thing really is a big part of this, because I give this example sometimes. I'm a family physician. All right. If you came to me to have cataract surgery, you'd probably be blind. Mm-hmm. Not because I don't care, not because I wouldn't want to try to do a good job, but because I don't have the training to do cataract surgery. So that's a big reason why people maybe don't get the health care that they need if they have a disability, or they're frustrated with the challenges that they might have in trying to get good health care because training is not there.
Correct.
And we have to be trained on how to do these things. And that is a deficit. In fact, in the past year, in 2022, there have been three kind of really big things that have come out. One of them was the National Council on Disabilities health equity report in February, and one of the big core components of what they said needed to be done to improve the situation was to integrate clinical training in every medical, nursing, health professional school in the country. And I emphasize clinical because there's kind of a difference between what I call disability competency in general and clinical competency. There's disability competency, understanding the world of people with disabilities and accessibility and communication styles and all that, which is very important. Don't get me wrong. But clinicians also need to be taught the clinical skills to provide healthcare to people with disabilities.
Couldn't agree more.
All right. Didn't mean to take the words out of your mouth there.
No, I absolutely think that was a very specific illustration of exactly what I'm seeing in the field.
Yeah.
So,
have anything you want to add to it or elaborate more, maybe from a nursing standpoint? Or
from a nursing standpoint, I think, again, just finding that connection where you can get the education, because on the flip side of all of this, there is some education available for us.
And what's one place nurses can get some education?
They can get some education from the Developmental Disability Nursing Association. And there's multiple outlets that are really coming to our easily available timeframes that we have to absorb those things. So I think that, again, it's just making sure that the information's getting out there, and hopefully, people are seeking that. I think in terms of other health issues from a nursing perspective, I think that training our nurses is super important. And I also think that there's been some growth and movement in that direction as well. So I know that St. John Fisher is developing a nursing specific program for persons with developmental disabilities. DDNA has the certification process that's kind of elevating that level of expertise. So I think that it's growing, maybe at turtle pace, but it's growing.
Yes.
We're getting there.
I will say this, that the 20 plus, 25-ish years I've been in this field, I've seen more emphasis, more recognition of that deficit, which is, you have to recognize your issues and problems first before you can fix them. And I've seen some funding available to do these or to implement education in different areas. I've seen that pace pick up more so in the past, I'd say 3 to 4 years than I've ever seen it. There seems to be a little momentum building, and that's really exciting.
It is.
A long way to go, but it's going in the right direction.
Yes.
So that's great.
Yeah.
So, all right. So, there are, challenges we know that affect health equity. But I kind of also want to focus on some good things that are happening. Are there some things you've seen in this field that are really moving in the right direction, or practices or examples of things that you can speak well about?
I hope so. So I had an opportunity to work with individuals with Prader-Willi syndrome off from my typical full-time job, and because I had extra time, so why not do more work? And it was my first introduction to persons with this syndrome, and I found it just absolutely fascinating, the resilience that these individuals had in their structured environments. So I worked with them for about 2 years, and then took a pause and worked with my agency, my full-time agency, to consider developing a structured program that could support these adults in a community-based setting, and still allow for them to have those independent opportunities that we would like to see with everyone else. What's unique with this syndrome is that in order for them to have lifelong happiness and good health, there has to be food security.
Yeah.
And now we're touching
for everybody to know a little bit about Prader-Willi. One of the big issues is kind of a challenge in feeling satiated, feeling full, and not knowing when to stop eating. So they typically will eat a lot.
Eat themselves to death.
There you go.
Yeah,
yes.
Honestly, eat themselves to death. And it can happen just in a blink of an eye. So there's way too many stories. We actually were trying to support a young lady with Prader-Willi syndrome in one of our community-based settings that didn't have food security, and she died at the age of 37 from a massive heart attack. She left her home and walked down the sidewalk to get on the bus to go to day training and died. And so I think that was the catalyst that really pushed my commitment a little bit more, and went back to the board of directors and went back to the CEO and just illustrated this example. And we did end up opening a home that is structured and designed for persons with Prader-Willi syndrome. And it's amazing.
Fantastic.
It is amazing. It took us about 18 months for that new development to actually open. And then just within the last 2 months, we've opened our second home and filled that. So unfortunately, in the state of Illinois, we had a number of adults that were looking for services in a food security structured program, and Illinois did not have those opportunities in enough abundance for the population. So Illinois started moving a lot of these individuals to Wisconsin, neighboring state. But as you can imagine, that's quite a distance for a lot of families.
Sure.
So we were able to bring 7 individuals back from Wisconsin to Illinois to be closer to their families and provide them a food security and safe structured home environment where they are just thriving. We have staff in the nearby area that catch wind of these specialized care homes, and we have a waiting list for staff who want to work in these homes.
Wow.
They are so inspired by what's happening in these homes, and they genuinely want to be a part of it. And I've never seen that happen with the shift in our workforce in the last 5 years, to ever see a waiting list for staff and managers and nurse in the background waiting to come work in these homes.
Congratulations.
Thank you.
And you're right. You never see a line of people waiting to work in most of these homes. Correct. Because we talk about the challenges right now in staffing and finding staff. So that's amazing to have people wanting to work there.
Yeah, the environment is just such a positive environment that it is really infecting the rest of our area.
Well, I was about to say, can you take some of that and spread it around?
Absolutely, and of course that's our hope, is that some of the activities and the things that are going on in these homes are things that can easily be transitioned into homes that aren't designed for persons with Prader-Willi, and again have the same kind of outcome. So it's an open mindset, and the people that are working with us are most interested in learning more about the syndrome and learning more about the individuals that have this, and they're just doing a phenomenal job, and I couldn't be more proud.
Well, I tell you what, the next time we talk, and there'll be a next time.
Okay.
I'm going to want an update on this. So that's
my
really
goal,
exciting.
My goal before we talk again, that I will be speaking about 3 homes that we have open, because I'm not done. I'm just not done. I think that
all right. That's a spirit. I love that.
Yeah.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisk.com to learn more about how you can employ these tools with people you support.
All right. So we're coming to a little place where we're going to do a little thing that's sort of a game, maybe. I don't know. But it's just a little thing.
All right.
So I call it 3 and 3.
Okay.
So you got 3 minutes to tell listeners things that they can do to improve this field in any way whatsoever, whether health and wellness, general supports and services, attitudes towards people with disabilities, in any aspect that you want to talk about. So 3 things in 3 minutes, and I'm hitting the timer now.
Okay. So the first thing I think that would be super helpful is to recognize those individuals with developmental disabilities, no different than you would recognize anyone else as they come into your store, your restaurant, your clothing stores, etc. I think that our individuals more than anything appreciate the kindness that is projected for them, not because they have a disability, but again, treating them as a normal person, and they just appreciate that. So I think that would be number 1. Number 2, please stop making us wait in the waiting room for an hour. Our individuals really don't like that. I don't like that. So when we go to the doctor's office, we'd rather that our wait time is a little less. So that would be nice. Get us roomed a little quicker. That'd be great. And then I think the third thing, oh golly, I maybe this ducktails on number 1. I don't know, but just approach these individuals as you would anyone else. They are adults,
first, right?
They don't want to be spoken to as anything less than, and they enjoy every normal adult activity. So they need those opportunities. So it would be nice if folks could just extend that for them.
Well, those are all great things, and you beat the clock. So
great,
so great.
It's rare that I win. I try.
You won. You get you get my thanks. How about that?
Sure.
No, but really, truly, I thank you for sharing all of your great work and your wonderful insights with us and the audience. And I can't wait until we can talk again next time to hear some updates.
Okay.